Welcome to Erik's Correspondence Corner, and thanks for taking the time to join us this week. Visited with a lot of students who came to Capitol Hill, St. John's Lutheran, also Southview Middle School from Edina. Look forward to visiting with a lot more students with spring break just upon us. We are going to jump right into our questions, though. Got a phone call this week from Christine in Coon Rapids. She expressed her concerns about healthcare choices. She says, Congressman Paulsen, I'm a working mother and I've used my healthcare savings account on many occasions for myself and my family. But the cap on how much I can contribute to my FSA, my flexible spending account, and HSA has limited my ability to purchase medicines. Is there anything you can do to make sure my family can continue to use these important accounts? I look forward to your response. Thank you, Christine. Well, Christine, thanks for reaching out. Number one, what Christine is talking about is a provision in the new law that has limited and capped the amount of money that can go into these flexible spending accounts, $2,500 a year. It's actually been cut in half. There's another provision in the healthcare law that prohibits using your own healthcare dollars in these accounts, HSAs and FSAs, from purchasing over-the-counter medications unless you get a doctor's prescription. It makes no sense for Washington to restrict these types of accounts. It actually results in fewer consumer choices and increased costs. It not only wastes time and energy and costs for folks that need to purchase these medicines, simple over-the-counter medications, but it also restricts the amount of time that doctors can spend with patients because they have more time where they're cluttered up in the office, visiting with patients, and sometimes even prescribing more expensive medicines. I've authored legislation along with Senator Johans of Nebraska to restore these provisions for both purchasing over-the-counter medications and raising the cap on flexible spending accounts to where it once was. Gives more consumer choice in healthcare. It will lower costs. Also heard this week from some folks about the budget. And this is an important issue because the House this week acted on the House Committee on the Budget's proposal to have a balanced budget. The House passed this initiative this week. I heard from a couple of people in particular. I got tweets, Facebook posts, but I did get a couple of emails from Robert in Eden Prairie and Ann in Chanhassen, both who expressed their opinion on the budget individually, and then they asked for my thoughts on the topic. First of all, I really do believe that Washington owes the American people a balanced budget. Why is a balanced budget important? Here's why. Number one, it gets our economy rolling again, provides more opportunity for young people, and it will save and protect and preserve important programs that our seniors and most vulnerable citizens depend on. We've been for far too long spending more than we're taking in, borrowing 42 cents of every dollar that is spent. That's not a sustainable position to be in. The House actually passed a balanced budget. We haven't had a balanced budget since the mid-1990s. Senate hasn't passed a budget in 4 years. They're now going to pass a budget, but it's not a budget that balances, ever. The president has not submitted a budget yet. Knowing that families and small businesses in Minnesota have to prioritize their spending, Washington should do just the same. If you'd like to express your views on the budget or any other issue, feel free to write in to me on my website at Paulsen.house.gov or on Twitter or Facebook, and hopefully we'll have a chance to draw your question and pick you for the next Correspondence Corner. Thanks and have a great week.